Thank you, everybody, for joining us in this session again. We had a great session on AMR where we were talking about patient insights and stewardship and how patients should be engaged in controlling this and how patients have a responsibility in ensuring the patient safety of not only themselves and their health systems, but also society at large. This session was carefully planned because I came into contact with a group called the Disease Experience Expert Panel, so DEEP as it's called. DEEP was comprised patients firstly from the diabetes front, but also then on the nutrition front, looking at obesity and others. These were people who had deep interest in the subject matter. They had through their life since young age, the type 1 diabetics, really worked hard in understanding their disease and made a good show of it, and they were really adhering to the treatment. But what was important and deep was they were inspirational. They were true advocates. This was the peers and peers of peers who really brought the essence of what being a patient and a patient community was. And I'm so glad today I've got Charlene here, who is now heading this program. And then I've got Ken Tate on that. And I've also got Sarah, sorry I couldn't pronounce your name, from Sweden joining us. Both Sarah and Tate can have led this group and have really been inspirational. Whenever I've met them in these deep panels, I've always emphasized that every health system should have a deep. You need to have this deep. And even when I go a little bit further, like we heard this morning from Jeremy Hunt, actually every minister should have a deep they could consult. You know, pick up the phone and ring you up. And Charlene, I hope you can do that for us today. Over to you now. The session starts and let's enjoy it. Thank you.
Thank you, Cavaldi, for this nice introduction. Good morning or good afternoon, everyone. It's nice to meet you or meet you virtually, and thank you for the kind words, Cavaldi. I hope we lift you up and inspire you with your work we've been doing together with Ken and Sarah. So my name is Charlene Coquerel. I'm currently heading up a team called Global Patient Relations at Novo Nordisk. The role of this team is really to bring the patient perspective into our organization and into our company. And today I have the pleasure to host this session together with Ken Tate and Sarah Mobach. They are both people living with diabetes, and you will hear from them in a very short period of time. And I think what we have tried to plan for you who are watching us today is really to, of course, focus on the theme of today, on patient safety, but also to inspire you on working and I think see how Sarah and Kate, Ken, with their different expertise, are also working with us, but not only the pharmaceutical industry, but also working with other stakeholders in the healthcare system. So I hope you find it some inspiration and you get energized, even though we are in this, unfortunately, new settings in front of our screens. So, of course, as a pharmaceutical company, safety is very important. Safety is very important when people are using our products and our innovations. But I think we are looking into, at least in our team, more a bigger definition of safety. People who are living with a chronic disease, and if I take the example of diabetes, because that's the disease that Ken and Sarah are living with, people, they are very responsible for their own chronic disease. They need to make hundreds of decisions a day, and that impacts their well-being and ultimately their health and their safety to a certain extent. So for us, we think it's very important, as Cavaldi mentioned, to bring the patient perspective there and I would say not just a patient, but their expertise as people living with this disease, and see how we can really look at these chronic conditions through different eyes, different angle to make a better life for people like Ken and Sarah. So we have developed this framework, as Cavaldiep mentioned, called DEEP, and I won't spend too much time on this today. I just would like to invite you, if you are interested, to come to our virtual booth in the exhibition hall, and two of my colleagues, Lucas and Morgan, are there throughout the day, so they will explain you how we work with people living with chronic disease in more details. I think it's more important we discuss concrete example on how we work together with the communities to drive a better agenda. And we have invited Ken to talk about a project called HyperResolve and how he is contributing with his lived experience to that project and what is the ambition of this project. And the second one, unfortunately, given the context of COVID-19 and the impact of COVID-19 and the link with diabetes, has also really meant for us that we need to play an active role together with the community on communicating facts around the implications between COVID-19 and diabetes. So without further ado, I think we should jump into our first topic, and I would like to invite Ken to introduce himself and share his experience as a patient advocate and why it's important for him, patient safety. Ken?
Good morning, or good afternoon, or good evening, wherever you are in the world, as the saying goes. Yeah, my name is Ken Tay. I'm originally from Scotland, Edinburgh. I'm now living in London, Borough of Bromley. I'm a person with type 2 diabetes, and I have been since 1999. And I am and have been married to insulin for the last 21 years, as I call it. Yeah, I became an advocate last year when Novo Nordisk asked me to give a talk on how diabetes affects stress and stress affects diabetes. Ever since then, I have been very much involved in various projects locally, nationally, and internationally. And I think we're talking about HyperResolve now, if you want to have it.
Yeah. So Ken, you're part of this project, HyperResolve, and HyperResolve, in your own words, it's a very complex project, but in your own words, and in 1 minute, can you give us a definition and an explanation of what is this project all about?
Yeah, okay. I'm a member of what's called PAC, which is Patient Advisory Committee. There are 8 of us at various places around Europe and even in Australia. We hope that we can help the research on this HyperResolve, which is basically getting all research and putting it into a database for people that can actually access it. And it can be anybody from researchers to the general public if they so wish. So that's basically what I do at the moment in HyperResolve.
And HyperResolve is a public-private initiative, and you mentioned you're part of this PAC, so this Patient Advisory Committee. Can you elaborate a bit more in which projects you are taking part of and the ambitions in these different projects?
There are 8 work packages, which have various titles and everything else, and some of them are quite long, typical research things. I am probably more involved in the psychology side of it, being a psychotherapist by day, and I have helped especially with things for work package 8, which is working on what are the definitions of hypos, and from mild to moderate to severe. And myself and Renza from Australia are co-authoring an article for BMJ on part of the systemic review of that. And it'll be coming out hopefully in October, November, and you're not going to get any inside of what we've just said, so because you'll need to read it there and then. I've also been involved in various other ones in Work Package 5, where they start at the start of when they were going to ask various questionnaires to people with diabetes and how to use language, the correct language, to on their questionnaires, so that it helps people with diabetes to understand what is actually going on. And I think that is important, that we need to be at the beginning as well as at the end of a project.
Mm.
Yeah.
And what do you think is your biggest contribution to this project? As you mentioned, you're new in the patient advocacy world, I would say, but what do you think is your biggest wish for this project and your biggest contribution to a certain extent?
My biggest hope in a sense is that researchers and professionals in the medical field will actually start using people with diabetes or any other long-term care to understand what it is like to live with it. They may know realities, as I call it, but they don't always understand how to live with diabetes or whatever. And I think we need to be part of the process from the beginning, middle, and end. And I think if we can achieve that as patients, then I think we've gone a long way. And I think it will help researchers to be much more open to what's actually going on in the world.
Mm.
Yeah.
Do you have an anecdote or a concrete example of how you have enlightened us and the researchers as well?
Well, that's a good one, because I can't remember anything. It's old age. Anecdote is helping people to. I mean, there was one where there was looking at an app in the HyperResolve, and they had various things at the end of information, and they didn't finish the sentence, and they hadn't looked at it. And being able to look at it as from a patient's point of view gave them an insight. Oh, we forgot about that. What happened? So it's, I think patients we are intelligent. We're not just people with diabetes. We are intelligent. We do have other attributes that we can actually give to the medical society, professions and things, and researchers. So I think we need to learn from that, or they need to learn that we can actually give things. Yeah.
Thank you, Ken. One last question before we bring Sarah and her perspective. So, unfortunately, since the beginning of this year, we are all living with COVID-19. What has been your biggest challenge or takeaway in this unfortunate context as a patient advocate? Is there anything you see as a positive outcome of this unfortunate situations that we are all going through, or what's your reflections?
My positive thing, I think, because we're now doing it virtually, I think we tend to see each other much more, which is, I think, is a good positive thing to me. Face to face, not everybody can get to a place wherever it could be in Europe. So I think that is the positive. The only negative is because we're not being able to see each other face to face, so that the time afterwards is spent much more fruitfully than actually face to face. So it has been positive in the sense that I'm meeting much more people worldwide about this disease, this horrible disease that we all have, and we can all help each other, I think, is the more positive thing. And we can do it virtually. We don't have to be face to face, and I think that is probably one of the best things.
True. Thank you, Ken, for sharing your reflections. I just would like to remind everyone that you are welcome to ask us questions through the Q&A. We would like these sessions to be as interactive as possible, so please share your reflections or thoughts or questions to Ken, Sarah, or myself throughout this session. Thank you, Ken. Sarah, moving on to you and your experience as a patient advocate, and I would say maybe a new type of patient advocate. Can you share with us who you are and where you're coming from, and what's your expertise in the patient advocacy field today?
Yes, my name is Sarah, and I live in Sweden, in Stockholm. And I have had type 1 diabetes for 18 years. I believe it's 19 soon, but I don't count. I have Sweden's biggest blogs about type 1 diabetes and an Instagram account I daily update. And with my social media, where I reach thousands of people, I want to inspire and motivate other people with diabetes to not make their illness a hinder to make their dreams come true, both small ones and big ones, of course. And today I also give talks online nowadays, and I'm also active talking about the combination of diabetes and eating disorder. And that's a subject that is so close to my heart when I myself was diagnosed with an eating disorder a few years ago. And with the collaboration on DEEP, I'm a DEEP member, and that means that I provide better awareness and understanding of what it's like living with type 1 diabetes, in my case. For example, like sharing my stories and providing the perspective of a person living with a chronic disease.
Thank you, Sarah. So, Sarah, we work regularly together, as you just mentioned, but when the whole COVID situations really came so present in Europe, we were very quickly realizing that we needed to provide more facts, or at least the facts we knew back in March around COVID-19 and the link to diabetes. And I think for us, it was quite evident as a company that we needed to work on this crisis together with you to find the right words and find the right information and which one to share, also to not overwhelm people, but also to make sure that the right information was sent through. So can you tell us from your perspective, I mean, beyond our collaborations, but also yourself as a Instagram guru, how you have handled that period, and yeah, top of your mind, what has been the biggest challenges in this new context?
Well, it has definitely been a huge change for me as a person and for me as a diabetic and be this advocate. I usually collaborate and exchange with my community by giving speeches, advocating, hold events, and also be more educated myself as a result of the pandemic in what's happened in, for example, research, development, technology, and more. And now during the pandemic, I've seen an increased focus on dealing with a new everyday life as a diabetic, and what's all that change for you when it goes from one day to another. It's a struggle with the blood sugar, for example. And but I think that with the pandemic, like Ken said, that it has been going from like this face-to-face communication to this telephone or video chatting with your doctor or a nurse, and also with your global, like with the global community that is out there. And my concerns, I think that the concerns for me as an influencer on social media, I think the focus has been more on exercise and eating the right thing, and not being focused as much as how the individually actually feels, like the emotion and what is going on inside.
Did you, as you said, you are very connected online. Have you seen new type of partnerships or collaborations happening since the beginning of this pandemic? Or did new people in the diabetes community reach out to you for advice or to find a reference in the different things you are doing?
Yeah, definitely. And people reach out more and more. And I think that's amazing, because I feel like when the pandemic came in March here in Sweden, I think we are talking more and more online, and we are able to reach out to people and to ask questions and like, is this okay? Is this emotion I'm feeling right now, is that okay? And yes, it is, because that's normal. And I believe that we need to talk more about the issues. And for example, the interview I was doing with Tim Skinner, that's an example for reaching out to more people and more global. And I think that's that is a real positive thing that has come out from the pandemic. Yeah.
So I can hear in your comments that you see you seem quite optimistic somehow for the future, or what's your reflections for?
Well, I feel like for me as a person and for a type 1 diabetic, I need to stay positive to actually survive. And that is my motivation to my followers and to the people I'm talking to, that it is okay to have a shitty day, and it is okay to have a bad blood sugar day, but you need to have some more things to look forward to, even if it doesn't have to do with your diabetes, for example. And even if I feel like we can't always think of the bad, but I always want to highlight the good stuff that has been happening from the pandemic. Like we're doing all these global online events. We are reaching out more, as we said before. And
yeah. Thank you, Sarah. I think in the matter of time, and we have received a few questions or comments, so I think we should maybe the three of us invite more people to ask us questions through the Q&A. But just we have received two, one from Clara, and thank you, Clara. I think it's more of a comment, but maybe you would like Sarah or Ken to react to that. Researchers and health workers would not exist without patients, but patients will always exist even without researcher or health worker. Keeping this in mind goes a long way to understanding co-productions and work. And I think, Clara, we all, Ken, Sarah, and myself, we all agree here. You are preaching to convince people that co-productions and working together is really the way to go to tackle the most important healthcare issues that we are dealing with at the moment.
Yeah, I think I totally agree with you, Charlene. That with Novo Nordisk, especially Novo Nordisk and DEEP and everything else, it really does work, and it helps a lot of people.
Yeah, and I totally also agree. And I feel like what Novo has done is a positive step into the future, like showing more globally and to have more people taking, like, you can share the information in an easier way. That's fantastic.
Yeah, thank you both. I mean, I think it's also something that this collaboration is also valued from our side, and I think it's important for us that you also gain something out of this partnership that we have. We also have another, I think, a comment that I'm sure Ken and Sarah, that will also resonate with you. One comment from Liz. So, of course, in relations to diabetes, there's a lot of, and I think maybe Liz, you're referring to this movement, language matters, because there's a lot of usage, especially in the media, on how they describe diabetes. And maybe I think you might talk about both here, type 1 and type 2 diabetes, and all of the stigma that are associated to this disease. And I think both of you, Ken and Sarah, that's also something you are trying to bring your expertise and try to also change that. Do you want to comment on this?
Yeah.
Well, like I said, yeah.
Carry on, Sarah.
Yeah, thank you. Like I said before, with that, like my concerns with social media has been like increased a lot during the pandemic. So I believe that all of us need to share what is actually the real life, except from diabetes, but with diabetes, and that it's not like normal to have this like flowery life like all the time, 24/7. It's impossible. We all have bad days.
Yeah, in the HyperResolve, one of the areas that we are actually talking about is actually making sure that language is relevant to everybody, not just to researchers and other clinicians, because reading some of the reviews and everything else, I have to look up Google, and many of these words kind of works out. So yeah, you're right, Liz. It does need to be much more effective and much more user-friendly, to say the way nowadays, and getting that language right can be difficult, especially if it's somebody trying to translate from a foreign language into English or English into a foreign language. So it does need to be not just in English, it needs to be in every language out there. It's my view on that.
Yeah.
And it would help the stigma. One of the things I talk about is the unconscious bias and narrative that goes around researchers before they do the research. And they need to understand that they need to park that somewhere and then do the research. So that
thank you much, Charlene. Sorry, we are running almost out of time. But just not to leave, thank you very much for here. I think, Sarah, you pointed out a very good, important issue. One of the reasons Sweden and some of the Scandinavian countries didn't have a lockdown very early on was that they were relying on people like DEEP to educate patients and work with them. And I think now this is the new reality. I think we will need DEEP with the next phases of COVID, that patients need to take a proactive action in this, and shutting down economies hasn't worked. So we will have to be invested in and brought forward so we can educate and shield our patients better. And Charlene, thank you much for putting this great show on. And Ken, thank you, and we'll keep on talking, Sarah and everybody else. And now I will ask the audience to leave this session and go back to the auditorium. And you can then join in the other part of this equation. I know every diabetic is using injections, insulin pumps, health devices. We look at health devices and the importance of that in the continuum of care. And thank you very much for this session. Really enjoyed it. And see you over the other side. Thank you.
Thank you, Kavadeep. Thank you, Sarah and Ken. Bye. Have a great day.
We're still here.
Yeah, thank you both. I think it's, yeah.
Thank you.
I don't know if you're live or not. I'm lost.
Hopefully
Yeah.
not.
Yeah.
It was great.
Yeah.
Yeah.
Oh, we did well.
Yes. I think half an hour is long and short at the same time. But we had, I could see there was a 70 participants, which is quite a good number of people online, I think.
Hi guys,
Yeah.
hello. Sorry to interrupt, but I am going to have to close the session. There are still attendees still logged in, so
Thank you for Yes, and
I'm
we
really
were-
sorry. I'm really sorry. I know you're in the middle of a conversation, but yeah, I'm going to have to ask you to leave so I can close the session down now so attendees leave and go on to the next one. But thank
Okay,
you very
thanks a
much
lot.
for your time.
Thank you so much. Hope to see you
No
soon.
problem.
See you.
Bye.
Bye.
Bye.